Numbers are out for 2026 across the board, not for Medicare Part B yet. That should be here fairly soon, if it probably going to be published while we're doing this live Q&A. But in terms of everything else, the annual earnings limit, the monthly earnings limit, disability, SGA, trial work periods, EPE, all those acronyms. I've talked about those several times. If you've got any questions about all things disability, survivor benefits, retirement benefits, Medicare, Medicaid, this is your opportunity. This is also a live Q&A, but today, for the first 10 minutes or so, we're going to focus on working and collecting Social Security retirement benefits. Specifically, we're not going to focus on SSI, which is Supplemental Security Income, the welfare-based program Social Security administers. We're not going to talk about SSI. We're not going to talk about SSDI, Social Security Disability Insurance. Those are completely different and very confusing. I did a video on that about a week ago for disability. But today we're going to focus on retirement benefits. And retirement benefits, the categories, the limits and everything apply to any type of retirement benefits. That includes retirement benefits on your own record, spouse benefits, divorced spouse benefits, independently entitled divorced spouse benefits, surviving spouse benefits. Yes, surviving spouse benefits are a form of retirement. Social Security has the same rules and regulations in terms of working and collecting those benefits. Okay, so we're going to go down the list. A lot of people get these confused and then they get in trouble. They get an overpayment or an underpayment, and they have issues. So let's make sure that doesn't happen to you and your loved ones. So remember, like, subscribe, share, and all that kind of good stuff. A lot of people don't get the information they need. Social Security is way, way understaffed, and they're not providing the information like they really, really should. So that's why I am doing this in my semi-retirement. If you're new to my channel, I ran the third busiest Social Security office in the country, and I've helped millions of people out with all of this stuff. So, all right, so let's go into it. For this year, you're allowed $23,400. And next year, the new number is $24,480. It goes up a little bit every year. So basically, let's stick with the next year. $24,480, anything you go over that amount while you're under your full retirement age, Social Security holds back $1 for every $2 you go over. So if you go $10,000 over, if you make $34,480, then that's $10,000 over the limit. So Social Security is going to hold back $5,000 of benefits. And some people already said, oh, how does that work? How are they going to hold back? Are they going to send me a bill for $5,000? No, you're already collecting benefits. So let's say you file for benefits right now, November, December, and you want your benefits to start in January. And when you file, you tell Social Security, okay, next year I'm going to make $34,480. So what Social Security does is say, okay, all right, that's fine, no problem. You're just going to be $5,000, or you're going to have to pay back $5,000. We're going to have to withdraw from your benefit amount $5,000, because it's $1 for every $2 you go over. So let's say your monthly benefit amount is $2,000. So you're not going to get $5,000, and you're saying so they'll hold back 2.5 months. No. They'll hold back 3 months. Why? Because they can't hold back partial months. So your monthly benefit amount is $2,000. So they're going to hold back 3 checks, January, February, and March. And you're like, but it's only $5,000. Yeah, but they can't hold partial checks. So the first check you will get is in April. But obviously, Social Security always pays a month late. So the April check comes in May. Okay. And then what will happen next year, if you're still under your full retirement age next year, is they will assume you're going to pretty much work the same. So if you told them $34,480, next year they're going to do the same thing. They're going to withhold 3 months of your benefits. Unless you call them up and say, oh yeah, actually I'm going to make $20,000 over next year, or next year I'm going to stay under the $24,000. Then you'll get the full 12 months worth of checks. Okay. What is this thing here underneath where it says $1,950 a month and $2,040 a month? What the heck is that? Okay. That is the monthly earnings limit. That is the first year you start your benefits. So here's what a lot of people mess up, particularly this time of the year. The end of the year, a lot of people mess up and they don't get the benefits they need. Okay, so how this works is the monthly earnings limit. Let's say, because there's a lot of people out there right now saying, oh, I've made over $23,400 this year, so I can't start benefits, so I guess I'll go ahead and start benefits in January. No, that might not apply to you. I always exaggerate for effect, old Marine Corps sergeant here. So let's say you made $1 billion from January of October to this year. You made $1 billion, or as Elon Musk, I guess he was announced that he's going to get $1 trillion package. So yeah, good for him. And yeah, the top few people own 50% of the Americans' wealth, and we can't get food stamps or, yeah. Anyway, a lot of people are going to lose health care, but hey, he's getting $1 trillion. So I'm going to be talking about him tomorrow. So he actually came, Dr. Oz and Elon Musk actually said, oops, yeah, remember all that stuff we were telling you? Yeah, well, it's not true. We got busted, but we're going to move the goalposts. I'll talk about that tomorrow. Anyway, so let's say you make $1 billion from January until October. Social Security doesn't care. They only care about once you start your monthly benefits. So if you say, okay, I want to start my benefits in November or December, they'll say, okay, how much are you going to make November and December? If you say, I am going to make $1,950 or under, they said, all right, cool, let's start your benefits in November. But I've already gone $1 billion over the 23,400. They don't care. Doesn't matter. Only matters when you start benefits. So hopefully there's a lot of people out there that, oh my gosh, wait a second, I can start my benefits this month and it doesn't matter what I made before? Correct. The first month you go under $1,950, that's when you can start benefits. But you have to stay under 1950. So if you start in November here, you have to be under 1950 this month, 1950 in December. And then next year, you can't do that monthly thing again. You can't make $1 billion in 6 months and then, go under the 2040. No, you have to be under the annual earnings limit for the entire year. So next year you have to be under the $24,480. You can't switch to a monthly earnings test again. Okay. All right. And some people, this is one of the reasons, one of the ways politicians beat up on Social Security. There's a lot of people out there that voluntarily get paid incorrectly. They voluntarily, of their own choosing, decide to get an overpayment. And why? Why would anybody voluntarily get overpaid, to get mispaid? Is because they say, well, this year the limit is 23,400. I'm still working. I don't know what's going to happen November, December. I might get some extra hours and I might be over a little bit. Or they say, yeah, I'm already over. And if I'm already over and they don't suspend my checks, what will happen is once Social Security finds out how much you made this year for 2025, and if it's over the 23,400, once you do your taxes and the IRS tells Social Security or your employer tells Social Security, whatever route it goes, then Social Security will look at it and says, hey, this person made $2,000 over the limit. So they send you a nasty gram that says you have to pay us back $1,000. And a lot of people just, okay, all right, that's fine. I'll just do it that way. Rather than calling Social Security and telling them, and hopefully they stop the checks. And once you get that, hopefully they restart the benefits. And then there's a 3-hour wait and you may have to talk to artificial intelligence for a while and yell at it for a while. So some people just say, forget it. I'll deal with the overpayment. And then once you get the overpayment, then you just deal with that. You have 60 months to pay back, no interest. That's why a lot of people voluntarily, that's how you voluntarily, everybody says, well, if Social Security makes a mistake, then they should, no, it's not their mistake. When you file for benefits, your reporting responsibilities, they give that to you. Your reporting responsibilities are if you make over, you have to tell Social Security, and just some people just decide not to. It's no big deal. They're not going to hold it against you. You just, oh yeah, you made too much, send us a check or set up a payment plan for 60 months. So no interest. So that's a lot of people do that. And politicians love that because even though Social Security has less than a 1% error rate, which is pretty phenomenal, a lot of that is people just deciding to get incorrectly paid themselves. And there's nothing wrong with that whatsoever. So, all right. So this is all before you hit your full retirement age. The year you reach your full retirement age, so if your full retirement age is next year, your FRA, full retirement age, is 2026. And let's say the month is July. So from January until June, you have to stay, for next year, you have to stay under the $65,160. So as long as you stay under $65,160 for those first 6 months, you're good. And starting in July, when you actually hit your full retirement age, you can go back to making $1 billion a month, right? What's this? And there's also a monthly thing. So if you make $1 billion in January, and then in February you stay under the $5,430, then they can restart your check. So there's that. And again, the year you turn your full retirement age, so the annual earnings limit triples, and also how much it withheld is reduced. So instead of $1 for every $2 you go over, Social Security holds back $1 for every $3 you go over. So the year you hit your full retirement age, no issues, or a lot less issues. And then starting the month you hit your full retirement age, how much is withheld? Zero, none. So you can go back to making $1 billion a month, and it doesn't affect your Social Security benefits at all. Okay. So that's a mistake that a lot of people make end of the year. They go ahead and file for benefits, and they start January because they think they're making too much this year, and they don't realize the monthly earnings limit. So, and if you do make a mistake when you first file for retirement benefits, you've got several options to fix it. Within 12 months, you can withdraw your application. So within 12 months, you say, yeah, I changed my mind. I'm going to go back to work, and yeah, I could call and suspend. So you can always call and suspend. If you start your benefits at 62 and then at 64, you find a good job, making 50, 60, 70, 80, $1 billion, you just call Social Security and suspend those benefits. Okay. And again, as I said, some people do, some people don't. If you're only going to go over a little bit and you're willing to deal with the overpayment when it comes, which is, again, not that big of a deal. You just come back here and we talk about overpayments all the time. Then it's no big deal. But if you're going to go considerably over and, pretty much have the entire year's benefits withheld, then it's a good idea to go ahead and call Social Security and suspend your benefits. Okay. So you can suspend your benefits or withdraw. On the withdrawal part, again, has to be within 12 months. And then you also have to repay all the benefits you received for those 12 months because you're withdrawing your application. It's like it never happened. And because it never happened, you should have never gotten all those months of pay. So you withdraw the application and then you pay back all the money. So a lot of people do that as well. So those are the two options, withdraw or suspend benefits. Okay, what happens to those checks? That if your benefits are suspended because you make too much money, what happens to those checks? Do you lose them forever? The actual checks, yes. But Social Security has this thing called the ARF, the Adjusted Reduction Factor. Basically, anytime you file for benefits early from Social Security, anytime for retirement benefits, spouse benefits, divorce spouse benefits, surviving spouse benefits, then again, you're limited to how much you can make, okay? And every month you retire early, your benefits are reduced. Your monthly benefit is reduced. So let's say you're filing for retirement on your own record and you file 30 months early. So your monthly check is reduced by 30 months. And then let's say after 10 months, you go back to work and the other 20 months you don't get a check because your benefits are in suspense. So once you hit your full retirement age and your benefits restart, Social Security says, okay, yeah, we've been suspending your benefits, for, the last 20 months. And now we're going to go ahead and send you a check because you're after your full retirement age and it doesn't matter anymore. Work doesn't matter anymore. So we're cutting you a check for your monthly benefit amount. But, oh, wait a second. The check that you were receiving was reduced for 30 months. So hold on, let's go ahead and recalculate this. So what they do is because you didn't receive benefits for 20 months, you only received it for 10, then what they'll do is they'll give you a a higher check that's only reduced for those 10 months. You don't necessarily get those, the 20 months back or anything like that. You just get your benefit amount gets unreduced. So you will receive a check that is only reduced by 10 months for the rest of your life. So, and that's 100% automatic, 100% automatic. Okay. What else? A lot of questions yesterday. A couple of people came into live Q&A and said, "Hey, I just got an increase on my benefit amount. What's going on?" It's COLA. It's not COLA, is it? No, it's not COLA. Not in November. So it's not the cost of living allowance that was announced. That was at 2.8%. It is because probably didn't know all the details of those stories, but this happens this time of the year. Because those people worked last year in 2024 and they paid more. And they paid in terms of the high 35 years, because that's how Social Security calculates your benefit amount, is based on your high 35 years of earnings. So the earnings they made last year was one of their high 35 years of earnings. So once Social Security gets notified of that, they look at it and they say, okay, this is a lot of money. Is it one of the high 35 years? Yeah, it's one of the high 35 years. So they kick out the low one, stick in the new one, recalculate. And because if it happens in, October, November, December, they say, well, you should have got the extra money starting January. So they give you that retroactive benefits for 10 months, 11 months, 12 months, however long it took them to calculate. So you get that one lump sum check added to it for, if it's $10 more a month, then they delayed 10 months, so you get $100. Plus going forward, you get an extra $10 a month every month going forward. Okay. Another question that's asked is what counts as income? Okay. On our website here, mygovexpert.com, we've got calculators that go through all of this. So if you go onto my website, and that's also where you can find in the bottom left a little camera icon that you can record a video. We've got a former Social Security employee. We're adding more. This is the only thing we charge for. Everything is 100% free, but the one-on-one appointments, unfortunately, we have to charge for. But it also pays for the websites and all that stuff. So we appreciate it. And the people that help you out are awesome. So they're former Social Security employees. They teach you how to navigate the bureaucracy, Social Security, retirement, survivor benefits, spouse benefits, disability benefits, and all the rest of it. So if you need one-on-one help, definitely. And you're also supporting all the stuff we're doing. Okay, so if you go on the website, which is 100% free, except for the one-on-one, you go into Social Security, click on retirement there, you click on working and benefits, and there's a little calculator there that tells you about how much you think you're going to be withheld for next year, for this year. And then it also talks about what's counted. So income that's not counted as income, obviously, you're actually Social Security benefits. So people say, well, I'm working, I'm making $24,000, whatever, but I'm also getting $12,000 of Social Security benefits. Does that $12,000 put me over? No. The Social Security money that you receive doesn't count against the annual or monthly earnings limit, nor does investment income, pensions, annuities, IRAs, veteran benefits, or any government benefits, including Social Security. So it's only basically wages, gross wages from employment, net earnings from self-employment, bonuses or commissions because it's part of your wages or whatever, vacation pay, sick pay. So what you get in pensions and all that, what you're pulling out of your IRA doesn't count against how much you're receiving for the annual earnings limit. Okay, we did that in 20 minutes. And let's see what kind of questions we have. Let's go ahead and move over into Julie. What's up, Julie? I need help pertaining to receiving my SSDI benefits I was approved for on September 22nd. So yeah, you were approved in September 20th. It depends on what level you were approved in. If you're approved at the initial level, then it's back at the Social Security office, and they, Social Security staffing is super, super low. So everything is taking 10 times longer than it should. It's been like that for a long time, but it's even 10 times worse now. It's all the people that were fired by Elon Musk. So congratulations on his $1 trillion pay. Anyway, but the rest of us, not so much. So if it's an initial, adjudicated hundreds of thousands of these, and it shouldn't take that long if it's an initial. If you have an attorney or anything like that, then it takes a little bit longer because they have to pay the attorney and all that kind of stuff. If you were approved at the administrative law judge, then it takes quite a bit longer because the ALJ, if they approve you, then they have to write it up and do this and send it to the process. And so it takes a lot longer. But depending on your particular situation, you need to call the local office, call the 800 number. And if it gets really, really, really terrible and you really, really need the money, then you just need to reach out to your politicians. That's the reason we can't get customer service, is because they don't want to provide customer service because they want to, destroy the system from the inside. They're doing a pretty good job. Steve, the only way to do great work, is to love what you do. Yes, that's, I agree. My neighbor was dual eligible with Medicaid, went on Social Security and income went too high, lost Medicaid. Can she get a supplement plan G without underwriting? Depends on the state, but probably not. Because she didn't necessarily lose her Medicare Advantage plan. So she probably had a Medicare Advantage dual eligible because she had Medicaid and Medicare. She didn't necessarily lose the plan itself. She lost eligibility for the plan. So it's kind of strange, but it also depends on what state she's in. So you can call our partners at Chapter, who also, sponsor and help us build all these websites and all this free stuff. So probably I'm normally she'll probably have to go through underwriting. So. And there's going to be a lot of people like this that are going to be losing Medicaid because you can't cut close to $1 trillion out of the Medicaid budget and not have it affect people that unintentional. They said, we're just kicking illegals off. Yeah. Undocumented immigrants do not receive federal Medicaid. Some states decide to give health care to undocumented immigrants, but that's not using federal money, right? So they cut $1 trillion and they're saying, because once we kick all these people off, it's going to affect everybody. And even if you're eligible for benefits, Medicaid benefits, SNAP benefits, or whatever like that, they're going to put up so many blocks, so many roadblocks. The states are, because they just don't have the money. They don't have the money to cover the people. So they don't have the money to cover the people that are actually going to be eligible. So they're going to cut back services as much as they possibly can, or make it so difficult to get benefits and continue benefits that people are just going to drop off. So we have to fight and make sure those who really are eligible for benefits get those benefits. So that's why we've started our other website, 24help.org, to crowdsource help out there for y'all to help your community, a hub for people to help people. So. Paul, when I applied for SSDI, I received a function report. I was informed I have filled out incorrectly. It may have caused me to be disqualified. Yeah, you have to fill out the forms correctly. That's one of the reasons Mai Jackson, who does the one-on-ones right now, she's putting together a team to help people, with filing for disability and CDRs and retirement and survivor benefits, because there's so much demand out there. So she's working on that right now. But yeah, you have to fill out those forms correctly and in triplicate. And it seems like, and even if you do everything perfectly now, because the offices, Social Security, Medicaid, SNAP, Section 8 housing got a 43% cut. They're all gonna, there's nobody gonna be there to help you out. And I think I came up with a little graphic there. Yeah, so you're gonna have the people in those offices are going to have hundreds of cases that they have to work on. And you think they're going to miss stuff? Absolutely. And is that a flaw? Is that a bug in the system? No, this is exactly how the system is being designed, to have one person do 400, 500, 600 cases, and they're going to miss it. And that's the intent. So even if you filled out that form 100% correctly, doesn't mean, so it's a residual function report. or was it the CDR? This is probably the residual function report, or it's basically saying that, okay, you're filing for disability. We just want to find out what's left in the tank, basically, to see if you're able to do any other work. And the current administration is also trying to change the eligibility requirements to make it more difficult, particularly for those people over 50, to get disability benefits. And so our community is going to take action on that as well to make sure that those benefits are protected. So, Delane, I'm signing up for survivor benefits, but I'm earning more than the limit. How will the checks come? Someone said they hold back some full checks for part of the year. Is that true? Yep. So that's what we just went through. So I saw your question before we started, and I think we answered it. If not, let me know, and I'll go through it a little bit again. Let's see. What other kind of questions here? Taken Took, what's up? How you doing? If these billionaires really care about the troops, they would be pressuring the R's and the reopening the government, passing the budget. That would be fully funded programs. Yeah, and they keep saying, well, the other side wants to fund illegals, and which is 100% incorrect. It's about the Affordable Care Act and the cuts to Medicaid. It's the cuts to health insurance for people that really need it. And now it's a Sophie's Choice type of situation. Do you want people to get health care, or do you want people to eat? You choose. Yeah, that's, if you watch Sophie's Choice, that old movie, you know exactly what I'm talking about. So if you make a lot of money, it does affect your Social Security because they deduct Medicare premium from Social Security. If I make $1 billion, what is the maximum they can deduct from someone's monthly Social Security for that year? Oh, good question. And that is, let me pull up the numbers here. So for this year, it's $176,100. So that's for Social Security. So that's the reason Social Security is in such dire need, why the Social Security Trust Fund is running out, because the vast majority of people, we haven't got a real raise adjusted for inflation since the 1980s. But we've made tons of money per capita, but all that money's gone to the top. And people that make over $176,100, anything over that, Social Security, they don't have to pay Social Security tax anymore. Okay? They pay it up to that amount, but after that amount, they don't pay it anymore. So we pay 6.2% on every dollar we make. If you're making $5 million, you're paying, a couple of percent, even that. So I think I've got the numbers here, but anyway. So to answer your question, next year it's $184,500. It goes up a little bit every year. But for Medicare, there is no limit. And people always say, oh, if you raise Social Security, if you smash the cap of Social Security, then the world will end and will become a socialist, communist country and stuff like that. It's been like that for Medicare for years and years and years and years. And the world is still turning. In fact, as of January 2013, if you make over $200,000 or $250,000 or married couples, you actually pay an extra 0.9% in Medicare out of FICA. So they pay a little bit extra, and the world didn't come to an end, did it? So I think I got for those new people that are joining us here. So this is basically it. If you make $50,000 a year, then you pay 6.2% on every dollar you make into FICA. Obviously, your employer pays the other 6.2%. Unless you're self-employed, then you pay both. If you make $500,000 a year, then you pay 2.18%. And that's what a lot of people say is, well, what our community believes is choking Social Security. So, Diana, what's up? I don't think we've seen you here. How we doing? I'm on an Advantage plan for 2025. In 2026, I'll be on Medicare with a Medigap N plan. Those are the ones I always say, if you can afford a Medicare supplement plan, and you're not super sick, or sick, variable, you can do an N or a G. I'm personally super cheap, so I would get an N. It's a little cheaper monthly premium, but N or a G is perfect if you can afford it, if it's in your budget. If not, then a lot of people, unfortunately, are the only option is the Medicare Advantage. I hate to say unfortunately, because that's the system. It's unfortunate that we have this system, period. But anyway, in 2026, I'll be on a Medicare with a Plan N. I'll sign up for Medicare D before 12/7. Anything I need to be aware of in this process? So you have to also sign up for a Medicare prescription drug plan at the same time, generally, as you sign up for everything else. Here's what a lot of people mess up, and more people are going to mess up going forward, is when you sign up for Medicare Advantage, most of those already have a prescription drug plan already built into them. And if you need help, just reach out to our partners there. Make sure you're prepared with all your 7 Ps, so you can find the best plan for you. So if you have a Medicare Advantage, your prescription drug plan most of the time is already embedded in there. When you get a Medicare supplement plan, you have to get a Part D plan separately, a standalone plan. And the problem is there's a lot of insurance people out there that they'll tell you, or they might not tell you because they don't get commissions, particularly now. There's a lot of companies that are not giving commissions, so they just expect these people out there who need to feed their families to help you with a prescription drug plan and not get paid. And looking up a prescription drug plan, all your plans, all your prescriptions, and whether it's an extended release and how many milligrams and how many, it takes time, and they don't want to pay people out there. So a lot of these Medicare insurance agents are just saying, oh, you don't want one? Okay, bye. That's it. And that's unfortunate. That's one of the reasons we reach out to Chapter. They say, well, yeah, we understand you don't take prescriptions right now, but if you don't sign up for one and you change your mind next year or the year after, then you have to pay a penalty for the rest of your life. It's 1% of the national average premium, which is about $30, $35 or so this year. So it's not a lot, but 1% per month, and you pay that forever. So it's good to sign up for a prescription drug plan, and you just get the cheapest one you possibly can in your area. And then because of the prescription drug plan, you can change that every year. So you get the cheapest one possible, and next year, October 15th to December 7th, if you start getting prescriptions, then you find one that covers those prescriptions and saves you some money. Medicare supplement, then you've got a Plan N, then you're probably good. If you got a Medicare supplement, you can also change your Medicare supplement to see if you can get a cheaper one, or maybe you want to switch from an N to a G or a G to an N. Depends on your state, might be able to do it. And it also depends on your health. So if you're looking to save some money, doesn't hurt to see if you can save some money. So, all right. Lisa, do I get an increase at full retirement if I continue to work and pay in? You get an increase anytime. Doesn't matter at your full retirement age. If you continue to work at 67, 77, 87, 107, doesn't matter. If you pay into Social Security and it's one of your high 35 years of earnings is how they calculate it. It's not your last 3 or 5. It's your high 35. So if you continue to work and pay into Social Security and that's one of your high 35 years, they recalculate your benefits with this weird pinpoint thing, and you increase your benefits. So absolutely. And that's 100% automatic. That's 100% automatic. So Diana, from my understanding, it will automatically end in December. We'll see what Penelope, I think I answered Diana. Did I answer that question, Penelope? If not, let me know. But if Penelope says whatever, it automatically ends in December, then she is 100% right on everything she's ever said here. So Diana, that's probably the fact. Chapter is impossible to contact. I'm asking you experts here. Oh, yeah, they are. For about 2 or 3 weeks at the beginning of the season, it's difficult, but they're worth the wait. You have until December 7th. So I think it's going to start slowing down from here on. So I think it's usually crazy busy for everybody the first couple of 3 weeks. So I think it's going to start slowing down. Try again. Do me a favor. Try again. Remember, they're open Monday through Friday from 8 to 10 o'clock East Coast time, 9 to 9 on Saturday and Sunday. Again, East Coast time. But do me a favor, call again if you're not able to get in. Some people just get in immediately, but if you're not able to get in, send me an email, ed@mygovexpert.com, and I'll reach out to them and make sure they call you. But send us include your phone number, because if I tell them to call you, they have to confirm that you called them first. If you just send me your name and I send it to them, they're going to say, yeah, we can't contact this person because we don't know if because by law, because they do everything right, by law, they can't contact you until you contact them first. So send me an email saying, hey, this is Diana or whoever, and I tried a few times and no luck. Here's my phone number. I'll send it to the team. And if they find you in their system that you did call them, then they'll call you back. And so, yes. Yeah, and some people have a question when they call Chapter. It says, if you have Social Security questions, press 2, and then you get returned to me. Because I told Chapter, I tell everybody out there doing Medicare, everybody wants to talk about Social Security, and they never work for Social Security. Everybody out there, if you didn't work for Social Security for a few decades and done this a million times, please, I'm getting an old Marine Corps sergeant here for a second, put it away. Don't talk about it. There's too much misinformation out there. Yeah, I've had to correct people continuously. And yeah, some people have taken their videos down and other people's just, yeah. So can anyone tell me what time of day Dr. Weir is broadcasting? Yep. 3 o'clock West Coast time and 6 o'clock East Coast time, pretty much every single day, and except for those days where my wife tells me I have to take off. So we all have a boss. Social Security benefits does not take money from earning unless you are not full retirement age. Does not take money from earnings unless you are not correct. Yes, if you're under a full retirement age, that is a fact. Yep. Unless you have an overpayment, then they do take money from you. Or if you have alimony or child support or something like that, or you owe the IRS or something like that, then they do take money. If there's a court order, they take money from you. But yeah, 3 months before my 65th birthday, do I have to select a Medicare plan at the same time I sign up for A, B, and D? Well, Part D is a Medicare plan. Those are, you sign up for Part A and Part B through the Social Security Administration. But Jeff, so if you are currently receiving Social Security benefits, retirement benefits, survivor benefits, spouse benefits, doesn't matter. If you're currently receiving Social Security, you will get signed up for A and B automatically. And then you have to, if you need it, if you want it, if you don't have health insurance from work, yours or your spouse's, the employer has 20 or more employees, means if you're exempt. But if you want it, you keep it. Keep the card. They'll send you your card, the A and B. And then, yeah, and then you need to start finding a plan. As I always say, whenever you talk to someone that helps you out with these plans, they're supposed to do what's called a compliant presentation. They're supposed to tell you about, okay, here's the gaps of original Medicare. And here are 2 ways to cover those gaps. One is a Medicare supplement. Here's what it is, And the other way to cover those gaps is a Medicare Advantage plan. And then they're supposed to just kind of shut up and say, okay, which one would you like to check out? And you say, oh, Medicare supplement. I don't like networks. I don't like prior authorization. Let's do Medicare supplement. Or if you say, yeah, I'd like to get a supplement, but the monthly, the premium, let's talk about Advantage. So that's how they're supposed to do it. So you can reach out to Chapter, whoever, and check it out. And again, full disclosure, if you use Chapter there and they find a plan good for you, that's best for you, that you like, then they support the channel like that. So, and it's a beautiful thing. So actually the big insurance companies support this channel, but I always say, don't tell them that. If they find out they're doing something good for the American people, they might get mad. I'm from Baltimore, Balvinder from Baltimore, December 58, working as a state officer, medical benefits from work. My question is when to approach Social Security. If you're currently working, okay, you're probably talking, let's address both. So in terms of money benefits, if you're currently working and you're over that limit substantially, then it's probably best to, at the very least, wait until you're full retirement age. You can wait all the way up until you're 70. If you wait until you're 70, then you get what's called delayed retirement credits. Your benefits increase 8% every year. Okay, so that's for the money part. In terms of health insurance, where you should sign up for Medicare, you're a state officer. I would reach out to your personnel management from your state, and if you're 65, then I would ask them, do I have to sign up for Part A or Part B? And they say, oh, no, you don't have to because you already got it, and you're currently working, yada, yada, yada. Sometimes they say, yeah, even though you don't have to, we like for you to, and we give you some extra bonuses or extra benefits or whatever, or because a lot of these places, if you sign up for Part A and Part B, they move costs over to the federal government. And you work for the state, so you know how states like to save money. So yeah, in your case, I would call up and say, hey, do I have to? And if they say, nope, you're good. And if you don't want to, then you don't have to. Once you sign up for Medicare Part A, Part B, next year, 5 years from down the line, whenever, you just have to provide proof that you did have health insurance since you turned 65. So let's see. The big, beautiful fleecing of America. Yeah, it's let's see. Let me get to some video questions. Chan, does the prescription come with BCBS? It depends what you're talking about. BCBS, that particular company, does Medicare supplement plans, plus they do Medicare Advantage plans. And most Medicare Advantage plans do have prescription drug coverage in them. The Medicare supplement version of that company doesn't. So it really depends on what you got there. So, all right, we've only got 3 questions, video questions today.
If you become disabled, you don't necessarily need the full 10 years of paying
Hi.
Social Security.
I have a question about SSDI survivor benefits. I am 65 and my ex-husband, who I was married to 13 years, died about 7 years ago, and I thought that I could get part of his benefits, but when I called the office, they said that I made more money than he did, and that I only qualified for my benefits, or rather it was more beneficial for me right now. Can you tell me where I can go to find the forms that might possibly help me with getting part of his benefits? Because right now what I'm receiving is very minimal and it's hard to survive on it. Thank you.
Okay. All right. Wow. Yeah. Number one, there is no widow's benefits at your age. Speaking of Angela, I told my friend what you said, and she followed the advice, and the Social Security office called her today, and she's going to get 2 months back pay, and they approved her Social Security. So you just got your friend 2 months of back pay. Again, I'm just some guy that sits there and talks to these cameras every single day. And if nobody watches and nobody shares and nobody tells their friends, we don't help anybody. So we've got the best community on social media. Angela, thank you. And you're also a member too. You're awesome. I appreciate it. That's what we do here, is help as many people as we possibly can. All right. So, yeah, for disability from an ex-spouse or a spouse, whatever, a deceased spouse, it's called disabled widow's benefits. So disabled widow's benefits, as you were married to someone that passed away and you're disabled, you have to be disabled between the age of 50 and 59. So in your particular case, it doesn't sound like you meet the parameters there, but I'm not exactly sure when your disability began. But you called them and they said that your benefits on your own record are higher. And they always, Social Security, if they're doing the right thing, they always pay you on the highest record. So it sounds like that's correct. In terms of the forms, there is no real forms for something like this, but Here's what I would do. Because Social Security, all of the really excellent people, including the people that we're about to bring on, are the best of the best. And the best of the best in Social Security are jumping ship. They were fired by Doge and Elon Musk, and the rest are just, they're just had it up to here of the nightmare that is happening. So they're jumping ship. So I'm just afraid someone didn't look at your record correctly. And someone just saying, when you call up or you go down to local office, and someone just saying at the front window, who might just be a CSR, a customer service representative, not an expert, not a Title II CS, a claim specialist. And if someone tells you that, that doesn't matter until you get an official decision. So what I would do, just to be on the safe side nowadays, I would schedule an appointment and demand to file a claim for survivor benefits. So you schedule an appointment to file for survivor benefits, and they say, yeah, whatever. And you say, well, okay, I want an official decision on that. I want to find out exactly how much the survivor benefits would be. And it may be as part of the claims taking process, you actually ask the person if they're a T2CS. That's what I was before I became a manager. Title II of the Social Security Act, claim specialists. Those are the people that do retirement, Medicare, SSDI, survivor benefits. So I just want to make sure you talk to someone, say, are you a T2CS, or even better, are you a T2TE, a technical expert? Those are the best of the best, and unfortunately, a lot of those are gone now. I just want to make sure you're talking to one of those before you make your final decision. So, and remember, there's a lot of other programs out there. Medicaid, if you're having a hard time paying that $185 a month, you can file for Medicaid, and if you're approved, they'll pay for that $185. The Medicare, it's called the Medicare Savings Program. So there's a lot of other help out there. So but unfortunately, all that help is being cut back because we just can't satisfy the billionaires. They just want more and more and more and more and more.
Hello, I'd like to know how I can get my Medicare Part B turned back on.
Yeah, and you see the situation here. That this is going to happen even more, unfortunately. So this is a person. I'm assuming here, but this person is in the hospital and refused Part B, probably because they couldn't afford Part B, which understandable. So they said, well, I'm not sick. And I, if I don't have the $185 a month, I'm going to be more sick because I can't afford money. I can't afford food. So they say they refuse Part B. They decline Part B. They cancel Part B. So $185, and they're good for a while until life is what happens while you're making other plans, right? Until you get in the hospital, and then guess what? You did need that insurance after all. But yeah, I understand that, people just don't have $185. That's why one of the reasons we have this channel and we have this awesome community is people go out there and share this information and say, hey, I know you can't afford the $185, but here's some other ways you can pay for that. Medicaid. And someone asked me about the Medicare Advantage Part B give back. And let me write a little note so I remember to talk about that. Okay, so how do you get Part B back? Unfortunately, if you declined it, if you canceled it, when you declined it, they gave you a form, 1763, and on that it said, hey, here's what happens when you decline it. Number one is you get a penalty for the rest of your life for every 12 months you don't have it when you're supposed to. And number two is you can't enroll in it again until the general enrollment period. The enrollment periods on Medicare, Medicare Advantage, Medicare supplements are just a nightmare. People miss benefits all the time because they don't know what they don't know in terms of when they can get this and that. And, we're in the big one right now, October 15th to December 7th. But in your particular case, I'm thinking because you refused it, you can't sign up again until the general enrollment period, which is January, February, and March. So you sign up in January and your Part B will start in February. And then, you get your Medicare Advantage or whatever the case may be to cover all the gaps. But that's generally how it happened. You might have an exception. You might have Medicaid or, whatever the case may be. There might be extenuating circumstances. So reach out to chapter there, reach out to anybody and say, hey, I want to re-sign up for Part B. Is there any exceptions to the exceptions that I can go ahead and sign up for Part B? Tell them your situation. They'll ask you a bunch of questions and they'll tell you whether you can sign up. And then you sign up for Part B through Social Security, or you can call Social Security directly and see if you can sign up. But yeah, anyway. It's a tough situation. Okay. So somebody had a question on this too about, so this is another question someone had about the Part B give back plans. So there's two ways you can get that $185 paid for. Again, reaching out to Medicaid, being approved for Medicaid, and they pay for your Part B. The other way is through a Medicare Advantage Part B give back plan. And the Part B give back plan is, as the name implies, you sign up for that Medicare Advantage plan and they pay for part of your Part B. So if your Part B is $185, it depends on what's available in your particular area. They might pay $50, $100, $185, whatever the case may be. It depends on what's available in your area. But be careful on those. I hate to break the news to you, but health insurance companies, billion-dollar health insurance companies, are in it for a profit. So if they're going to pay, let's say $100 a month for your Part B plan, they're going to find that money elsewhere. So if you've got a regular plan that doesn't pay for your Part B and then one that does, then look at all the other prices, the details. So the one that does might charge you $500 a night for a hospital, and the one that doesn't charges you $100 a night. So they're going to get that money back. They're not, okay, I won't finish that sentence. So generally that's the situation in your particular case, but there might be extenuating circumstances, so I would definitely reach out.
So
Hi, Dr. Ed, and everyone in the community. Someone asked a question about SSA Pass, plan to achieve self-support, and he was unable to get information at Social Security. So I was just wondering if you could address that person's question and give details about it. Thank you.
Okay, the PASS program, plan to achieve self-sufficiency, self-support. It's for those people on SSI, Supplemental Security Income. Okay, again, that's the welfare-based program Social Security administers. So it's for those people, and it basically says, okay, you are trying to get out of receiving, I'm checking the acronym, plan to achieve self-support. Okay, so many acronyms, so little time. Plan to achieve self-support. So it's basically you're on SSI and you say, hey, I'd really like to get off SSI. I'd love to get off disability. But in order to do that, I need some training. I want to start a small business. I need some tools. I want to be a shade tree mechanic. I need some tools. I need, I need a little bit of an investment. And the problem is when you're on SSI, because it's a welfare program, they look at everything. So, and the max you can get on SSI is $967. Anything you work pretty much, for the most part, offsets how much you get from Social Security, from SSI. So part of the PASS is saying, okay, you want to go back to school and learn to be a hairdresser. And that's going to cost you $5,000. And it's good for you. It's good for taxpayers. It's good for everybody if you're able to do that. But in order to get that $5,000, you have to save up a little bit of money and work a little bit more. So normally you're limited to how much you can work. But if you work a little bit more, let's say an extra $200 or $300 a month, you can go with that pass. You can set up a pass. It's actually a plan that you have to reach out to Social Security and say, here's my plan. And they look at it and, confirm it, says, okay, you want to be a hairdresser, you need $5,000. Okay. So now you can work and make over. Normally that would shut off your SSI, but that extra $2 or $3 or $4 or $5,000 to $2 or $3 or $4 or $500 you made over, you're going to put into this kind of pool until you get to $5,000. So we won't count that as resources or income. So that's how it works. It's a phenomenal program. But I could see that you call the local Social Security office and they're to help. Nobody there to help you because there's nobody at the. One of the problems with Elon Musk and Doge vacating all those people from the Social Security premises is they just took their chainsaw out and did it haphazardly. So some offices, it's like, oh, my office is open. Yeah, but what's it open for? I need to file for retirement benefits. Well, the only people in that office are left over SSI, welfare-based program. So they don't know retirement, or vice versa. You need to file for SSI, and the only people left are Title II, the people that do retirement survivor benefits. So yeah, and then they lost their TEs, and so they're expert. Yeah, it's a nightmare situation. So, all right, is there any way to get benefits off of a common law spouse? Never married, but was together well for 40 years. It depends on your particular state. So I would file. And Social Security has all of the state laws because Social Security has to recognize and, they accept any state laws because marriage and divorce are state institutions, right? So whatever the state says, Social Security has to go by. So if your particular state says they recognize common law marriages, then Social Security has to recognize common law marriages. But be careful. Some people say, I check my state and they don't do common law. Well, maybe not now. Some states have switched. If you were married 40 years, did they recognize it 30 years ago? So that's what I would check. And Social Security has in their PALMS policy and the policy manual, they have all of the states that recognize common law marriage and all the ones that used to recognize common law marriage. So I would definitely check it out. So, thanks for explaining past, Dr. Ed. Hopefully the person that asked yesterday gets the info. Yes, thank you. Oh, so you're looking out for somebody else. You guys are just too awesome. Yeah, when I miss a question and it kind of, because I get all these questions just kind of fly up. Sometimes I don't see it when I need to, and y'all always look out. You're awesome. Let's see here. I'm 58. At 26 years of work, I can retire, but I can't continue to work from a traumatic event, PTSD. Yeah, so if you're 58, you obviously can't collect retirement benefits. The only thing would be available would be Social Security disability benefits, either SSDI or SSI. At 58, you could also be eligible if you were married to someone that passed away, disabled widow's benefits, disabled widower, same thing. But yeah, if you're 58 and you're no longer able to work, because that's how Social Security defines disability, as the inability to work, and you can still work actually. This is what a lot of people mess up. And we used to get calls, all offices get calls all the time and said, this person down the street is on disability, but they go to work every day. Yeah, they're allowed to work. They just there's a bunch of limitations, on that work. And one of them is, let me move it up here, for 20, excuse me. For this year is 1620, substantial gainful activity. So basically what that means is if you are currently working, making over $1,620, they are going to deny your application. There is some little wiggle room in there if you're having to pay for extra, wheelchair or car, the lift or something like that. There's, it's called impairment related work expenses. But generally, if you're making over 1620, they're going to deny you because you're working substantially. Next year, it's 1690. But if you're working and making under 1620, under substantial employment, then you can file for disability benefits. And do it quickly. If you're unable to work, don't sit around and wait. Well, I got a test. I got to see a doctor next month, and let me get my medical records together, and let me do this, and let me do this other thing. No. File. Because it takes forever to get approved nowadays. And so you go ahead and file, you give them all the information. And if you have some other information that comes down a week or 2 weeks or 3 weeks later, you just update it. But file for benefits. Don't wait because it takes just way too long. Iona, first time here. What's up? How are you doing? My premium bill for Medicare Part B is based on salary before I retired. I filed an appeal, no response, 3 months. Can I pay what it should be while waiting? I wouldn't do that. Turned 65 in July, retired in March. Okay, so you got the IRMA, the income-related monthly adjustment amount. So they looked at your earnings from 2 years ago, guess when you were working, and they said because you made a whole bunch of money, then you have to pay a higher Part B premium. So that is a reality. People that make a lot of money pay more money into Part B premium. Not only do they pay more FICA taxes and pay them forever, but they also get the 0.9% we talked about. And once they start Part B, they pay more money for Medicare. And the world didn't come to an end, right? But in your particular situation, you have what's called a life-changing event. And you filed the form SSA 44 that says, I have a life-changing event. Don't charge me extra. I should only pay $185 like everybody else. I wouldn't do what you suggest because if you don't get it in, if you don't pay it, then you're going to lose Medicare and it's going to be a nightmare. I can guarantee you that they lost your SSA 44. Or probably what happened is there's usually only one person. We had one guy in our office, Keith. Hey, Keith. Who did those IRMA appeals. And about this time, or whenever usually in the beginning of the year or so, mid-year, he used to have a whole stack on his desk of those SSA 44s that he would have to adjudicate, make decisions on. And if Keith has that big stack there, and all of a sudden Doge comes in with their chainsaw and decides to kick Keith out, that stack is still there. And there's no other employees that have capacity to take up that work. So your SSA 44 is probably in a stack of someone that's, now retired. Possibly. That's what I'm figuring. So you need to reach out to that office and say, hey, it's been 3 months. I'm tired of paying this money. You need to, make a decision and push the button. The good thing is if they determine they approve that appeal, that life-changing event, which it sounds like they should because it was based on work, you stopped working. So that's a super, super easy one. So all the money you paid starting July 2025, the extra, they'll pay that back. They'll do it retro if they do it correctly. If they input it in the system correctly, then they will pay all that money back that you overpaid. Essentially, you overpaid. So let's see here. Sick and tired. What's up? Yeah, I know what you mean sometimes. Social Security took son off disability, determined he can work. Son has schizophrenia, not able to work. He had SSI disabled before the age of 22. This was a nightmare. 1 year of appeal. How does this happen? Yeah, there are some disabilities, mental disabilities, which are, fibromyalgia, back issues that are just more difficult. Someone has a traumatic, like cancer or a car accident or something like that. Those are slam dunks. Sometimes those are approved the same day or the same week. But things like this are, yeah, it's a super gray area, but it depends on the severity. So you just do the appeal, and 1 year of appeal. So if it took a year to appeal, that was probably your second appeal. You file the initial claim, it's denied. You file the reconsideration. That one usually takes about 6 to 9 months, but in your particular case, because of the condition, yeah, it might take a year. And then the next step is the administrative law judge. The administrative law judge has a lot more latitude, a lot more freedom to kind of read in between the lines a little bit. So, so you just have to keep fighting. You just have to keep fighting. And if they're approved, they will get all that back pay. So if the administrative law judge says, yeah, you should have never taken this person off of disability benefits, so I am ordering you, Social Security, to pay this person in full from day one. And yes, and then they will do it. Georgia stopped recognizing common law marriages in 1997. Yeah, so some states do it, some states don't. So, and again, some states did prior, and people are missing those benefits because they call up, oh yeah, no, I've heard that my state doesn't do it. But you were married in the 70s and 80s, and they did at that time. You just had to be married 10 years, common law, holding out as a husband and wife for 10 years to get those divorce spouse benefits. So, all right, we are out of time. Oh, one last thing. Remember, again, this is the most important thing is to make sure that we get information out there. I'm dependent on y'all to get this information out there. So please like and subscribe and share. And then on my YouTube channel, on my YouTube page, in the community post, I put 3 examples of emails that you can send to famous people, celebrities, news stations, newspapers, whoever. So I've got 3 different examples of emails. You just cut and paste an email, whoever, and says, hey, we need to get attention to help that's available. A lot of people need help. They're not getting help from Medicaid and SNAP and Social Security. They've got a bunch of answers. They got a bunch of questions they can't get answered. And this is what we do every day. So we just need more and more people to join us here. And we need those people to help out other people. But that we need to arm them with information so they can go out and help other people like our people do every single day that are already here, that are already part of our awesome community. Okay, y'all take care, and tomorrow I'll be back talking about Elon Musk and Dr. Oz moving the goalposts, admitting they were wrong. And so people like that don't admit they're wrong. They just move the goalposts. And so we'll talk about that tomorrow. All right, y'all take care. Have a beautiful night. And please, 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 please take care of each other. Bye-bye.